Now, my first show here on GB News at 7 o'clock was on the 19th of July last year. And the first show I did, I said I thought we had a massive looming health crisis. A waiting list of over 5 million people waiting for procedures, huge numbers of people, we now learn the number is 10 million, who have not had various medical checks and screenings. And I speculated that we're heading for a huge looming health disaster, and that perhaps one of the ways we can partially deal with this is to use the private sector more extensively. And my belief that the private sector could upscale more quickly than the NHS and the public sector. And I've argued consistently since July the 19th that one of the ways we could help take pressure off the National Health Service is by giving people tax incentives to get private medical insurance. Well, I was really delighted that yesterday in the House of Commons, a senior backbench Conservative MP took the same view.
People of a certain age, of which unfortunately I'm one, are terrified because they think that if something goes wrong they may have to wait in pain for 2 years, and we can't wait till March 24 to join the back of a slightly shorter queue. And then we see our friends who have private health insurance, I'm not one, we can't afford it, and we see that they're seen within days. So may I suggest one policy which would be wildly popular with many of our own supporters, which every Conservative government did till 1997, that is to give tax relief to private health insurance. And before the... Well, why not look at every innovative solution which actually unleashes new money? And before the Secretary of State says that's for the Chancellor, we'll at least put it at the back of his mind so when he's next talking to the Chancellor, he at least discusses it.
Mr. Speaker, I'm always pleased to talk with my honourable friend about his ideas and suggestions, and we'll be happy to meet with him and discuss this further. But I'm sure also he does agree with me about the importance of making sure that we are investing in the NHS, investing in the workforce, so they can deal with as many people as they can possibly can.